everyone. My name is Kimberly Seals-Allers, and welcome to the Mobilize Maternal Health Coalition press event and live stream. One thing we know about the policies that we need to create going forward in our state and even beyond our state, they must be connected to people. And we can't forget this, right? The people that we intend to serve, not just as reviewers of the policy, but as ideators, as co-creators, to be at the table from the very beginning, helping to create these policies so that we know that they're rooted in real community voices and that they are actually going to impact people. In our work, lived experience matters, right? It's not just about being able to access care, but the experience of that care is what's really important. So how do we make sure that the lived experience of a policy, not just the stated version of it, is also very much part of what we're pushing for? So our policies must go beyond paper wins so that they are truly people wins and that our community benefits from our policy advocacy efforts. And this is why the Mobilize Maternal Health Coalition is so important. And so we are here to action, to move what we know is movable, and to push for the change that we know that birthing families all across the state deserve.
Next up, I will introduce a wonderful, I can't even put enough words to the appreciation that I have for Samantha, Executive Director of PUSH for Empowered Pregnancy. I participated in similar events and have seen the work that she is really rallying up around her and the importance of the stillbirth crisis in New York, which often gets left out. And so, Samantha, would you please share more about who you are, what you're up to, and give an intro to everyone about the legislation that you want to uplift today?
Absolutely. Thank you so much, Mila, for the intro, and thank you to everybody who is here today. As Mila said, my name is Samantha Banerjee, and I'm the Executive Director of PUSH for Empowered Pregnancy. We are a national 501c3 nonprofit based right here in New York, and we are dedicated to ending preventable stillbirth in the United States. I am also mom to Alana, who was born still in 2013, just 2 days before her due date after an otherwise normal and healthy pregnancy. And she was one of 65 American babies born still that day and every single day since. Like my Alana, most of the approximately 1,300 babies lost in New York to stillbirth each year are healthy. In fact, 80% of stillbirths are taking place in pregnancies that start with no known maternal risk factors. However, most parents never hear the word stillbirth until it happens to them or someone they love, even though it's claiming more U.S. children's lives each year than prematurity, SIDS, car accidents, drowning, guns, fire, poison, flu, and listeria combined. So PUSH is a proud member of the Mobilize Maternal Health Coalition, and here today to raise awareness not just about stillbirth, but also about New York's inhumane revocation of paid family leave after a baby is born still. Defined as taking place after 20 weeks gestation, stillbirth means that the baby who has died must be born just like any other, leaving stillbirth moms with the very same postpartum conditions. As we know, the postpartum period is one of the most dangerous times for birthing people, particularly for BIPOC families. Black women in New York State are 3.5 times more likely to lose their lives than white women due to complications of pregnancy or childbirth. And in New York City, they're 9 times as likely. 60% of maternal deaths take place in the postpartum period, with 2/3 of those happening in the 6 weeks immediately following birth. That's the exact period when New York stillbirth moms are being stripped of their leave. Black women are also more than twice as likely to suffer a stillbirth, and all stillbirth moms are almost 5 times as likely to experience severe, potentially life-threatening maternal complications. This means that stillbirth is, in a very real way, putting the lives of New York mothers at risk, and this burden is being disproportionately shouldered by families of color, though it can and does happen to anyone. Here to share more is Cassidy Perrone, mom to Olivia, who's been leading the fight to fix this dangerous and cruel loophole in New York's paid family leave law.
Thank you so much, Samantha. And I just want to thank all of you for being here and for putting maternal health first. And I really want to thank Push Pregnancy for coming alongside me in my darkest hour and fighting every day with me tirelessly. As Samantha stated, my name is Cassidy Perrone, and I am the mother of Olivia, who was born still on March 17, 2022, at 36 weeks gestation. After 17 grueling hours of labor, I walked out of that hospital devastated and empty-handed. The day after her funeral, I received a call from the state of New York asking me to voluntarily withdraw my previously approved paid family leave application because Olivia had passed. I refused because I had been relying on that nearly $1,100 a week in paid family leave to recover postpartum for nearly 9 months of pregnancy. And as the primary breadwinner in my household, I was forced to make the unthinkable decision when they revoked my paid family leave to either follow the medical advice of my doctor to take a minimum of 6 to 12 weeks unpaid leave or pay my mortgage. I was either going to have to take unpaid leave or go back to work and pay my mortgage. She informed me that even if Olivia had lived, she could not write me back into work because of how dangerous the postpartum period is, especially being a stillbirth mother and being 5 times more likely to suffer complications. To add insult to injury, my husband still qualified under paid family leave to take time off for me to recover postpartum. But I didn't have the ability to take the time to recover myself. Think about that. For the past 3 years, I have been fighting alongside Push for what seems like forever to try to close this dangerous gap. This is money I will never receive, but I need to make sure that no other mother or birthing person is put in such a cruel and inhumane place in their darkest hour. The overwhelming response to try to change this law has been very positive from lawmakers. Both Democrats and Republicans agree that this is not a political issue. This is an issue of humanity. Yet, Assembly leadership has continued to roadblock our attempts to close this gap. Enough is enough. We need to reach out to our Assembly leaders and Governor Hochul and demand that this gap be closed through the 2025 budget process, whether it be through paid family leave or through increasing temporary disability insurance. We need to get the job done so that this cruel and inhumane treatment of stillbirth parents and birthing persons does not continue in their darkest hour. Thank you. And at this time, I would now like to pass the floor to Jesse from A Better Balance, who will be addressing the broader impacts of paid family leave and medical leave reform for pregnant families and all workers in New York through the Temporary Disability Bill A84, which is currently before lawmakers. Thank you.
Thank you for having me here today. My name is Jesse Workman, and I'm a senior staff attorney at A Better Balance, a legal organization dedicated to advancing justice for working families in New York and beyond. And I'm also a parent, and as someone who had a home birth in New York State, these issues are very close to my heart. Access to paid leave can help improve maternal and infant health outcomes by giving parents the time they need to manage their health needs and supporting families when their financial security matters the most. Right now, if you're a worker in New York and you need leave to care for a new child or a loved one with a serious health issue, you can take up to 12 weeks off, receive up to 67% of your pay, and have the stability of job security and continued health insurance. If you're that same worker dealing with your own serious health condition, which may be a complicated pregnancy or birth, cancer, or another condition, you get only a maximum of $170 a week. And that's a number that has been unchanged since 1989. What's worse, you could lose your job and health insurance coverage while you're out on leave. This unacceptable disparity exists because New York's medical leave program, called Temporary Disability Insurance, or TDI, has not been updated in over 35 years. And in that time, many states across the country have made comprehensive paid family and medical leave a right, but New York has fallen behind and left countless workers, including those with growing families, to make impossible choices. Through our free, confidential, and legal helpline, we hear many stories from New Yorkers with complicated pregnancies and traumatic birth experiences who, on top of that, are left scrambling to afford basic needs because our state's TDI program lags so far behind. Urgent reform to TDI is needed to address the maternal health crisis in New York, which, as Samantha described earlier, has a disproportionate impact on BIPOC women and families, and also to ensure that all workers can afford to take leave when they need it most. We are part of a large and diverse coalition working to pass these bills, which would bring much needed reform to New York's paid medical leave program, including raising the wage replacement rate to match paid family leave, allowing for intermittent leave, and adding vital job protection and continued health insurance. No worker should be forced to sacrifice their health for a paycheck. Our lawmakers need to hear the voices of all New Yorkers calling for the passage of A84 S172 now. And for more information about this campaign or workplace leave rights, including accommodations during pregnancy, please visit the resources that have been shared. Thank you.
Thank you so much, Mila. And just a quick reminder to everyone, everything that we have spoken about today is available on the Mobilize Maternal Health Coalition website, which summarizes everything. And we are just so incredibly grateful to everyone for being here today, to all of the amazing speakers. Please use hashtag Power to Mobilize on social media. Thank you so much. Have a
Take
great
care.
day.